And with COVID numbers heading in, as the health minister put it, the wrong direction, there have been increasing questions in the past few days. Now, Health Minister Dr. Christopher Tufton now joins us live via Zoom. Dr. Tufton, welcome to Primetime News. Thanks for joining us.
Hi, thank you very much. Good evening.
All right, first of all, hotel guests, hospital workers, and now a general positivity rate of over 48%. Is Jamaica now in the fourth COVID-19 wave?
Yes, and that's something that I certainly said earlier, a few days ago. I think it was on the eve of the new year. And we don't go by 1 day's number. We look at averages, normally looking at the 7-day average and the trend over that period of time. And as we have seen the last 2 weeks, there have been a fairly significant increase in terms of positivity, reproductive rate, and a less so, but nevertheless increase in hospitalization. And this, to my mind and to the minds of the experts, confirms that we are in the fourth wave, as we had predicted.
So in light of the numbers, why is face-to-face school and other gatherings not being curtailed as was done previously?
Well, first of all, the response to COVID evolves over time. We've been at this for 2 years, almost 20 plus months. A lot has happened since then in terms of the response, in terms of the protocols that have been put in place, tried and tested, the vaccination that have been made available. Some have taken it, some have not. Those who have been infected and have recovered would have built up some amount of immunity. And not to mention the side effects of the restrictions over an extended period of time, which has had an impact, not least of which on our children who have been kept out of the classroom, have been affected badly in terms of their own learning and not to also even their mental health. So it really comes down to how we balance the different variables. Not to say we are not taking COVID seriously as a government. We are responding. We are continuing to encourage the different types of responses. And we're taking precautions at the level of the schools to ensure that our children and staff are protected.
So you stand by resuming face-to-face classes? So you stand by that, resuming face-to-face classes?
Well, up to this point, the government is standing by that position. I'm a part of the government and we provide technical advice around the protocols within the schools. Okay. There are risks. There's no doubt that there are risks. As we go along, I'm sure the cabinet will evaluate those risks and make decisions as to what is in the best interest of our children in this instance. But for now, we felt that it was a risk worth taking because of the negative impact of keeping our children out of the classroom for an extended period.
I just want to move on now to the hospitals themselves. Last week, the University Hospital of the West Indies confirmed 4 dozen cases among its workers. What is the situation with other hospitals and the sector in general?
Well, the positivity rate and the extent of the pace of increase and the increase itself is not going to protect any particular segment of the population. It's right across the board. And our hospital workers are on the front line and therefore are most vulnerable. So we do anticipate and expect that we will see positive cases. The protocols there deal with that when they occur. It's about extracting persons from the environment, treating them, doing random testing, and sanitizing, mask wearing, PPEs and so on. So I think we have, having gone through 3 waves, now going into the 4th, we have had enough experience to understand what needs to be done. And we are making arrangements to take all the necessary precaution, expecting that sometimes we will have positive cases to deal with.
Okay, you mentioned vaccination. I want to move quickly to that. As it relates to vaccination, some sites had no AstraZeneca vaccine today. What do you believe led to this?
Well, there are some distribution issues which we're trying to sort out, some inventory and distribution issues. A discussion is taking place as we speak at the level of the ministry and the National Health Fund, which is responsible for not just procurement, but storage and distribution, the logistics. We're hoping to sort it out within a short period of time. So I just want to reassure persons, don't be alarmed. We will find a way to address the challenges that we have. And I'm expecting to get a report tomorrow to see how much more details there is on the particular situation.
Can you say if anybody was turned away because of that shortage for booster shots today?
I don't have evidence, but I have no doubt, because I do believe that persons would have turned up at locations perhaps to get that particular brand. Other brands are available, but if there's a preference for the AstraZeneca and some locations would have run out, there is the very strong possibility that some would have been turned away. But we will hopefully overcome that situation in the not too distant future.
All right, can you confirm the number of vaccines that had to be dumped at the end of December? AstraZeneca because of expiration.
I don't have the details in front of me. I believe we did make that public earlier in the late year, that we would have had to once they expire. And that is likely to be the case with every passing month if they are not used up. But I can get that information, but I don't have it with me.
Okay, fair enough. Do we have enough vaccines going forward?
Well, we do. We have enough vaccines. As I said, we need to work on an issue that has emerged with the AstraZeneca brand, which the team is working on, and we will hopefully solve that issue over the next few days. But we do have a fair inventory of the other brands, and those brands are being offered to the population. And my advice consistently to Jamaicans is that the best vaccine is the one that's available. The issue of vaccine shortage is no longer a big issue. It's an issue that can be solved relatively quickly because there are supplies available globally.
Okay.
And so take what you can get, and if you need a second dose or a booster dose, that will be made available over time.
Okay, good. Thank you very much. A lot more questions could be asked, but we're out of time right now. Dr. Tufton, Health Minister, joining us here on Primetime News. Thank you very much, Dr. Tufton.